Assalamu alaikum. I am Dr. Mohammed Atiqur Rahman, Assistant Professor, Department of Dermatology, Bashundhara Ad-din Medical College. Today's topics is Pyoderma. What is Pyoderma? Pyoderma means pus in the skin. It is frequently asked in the exam or on written. Name some Pyoderma disease. The answer is psychosis barbae, abscess, impetigo, pyogenic paronychia, boil or cellulitis, furuncle, folliculitis, carbuncle, and Pyoderma gangrenosum. Erysipelas, ecthyma, and botryomycosis. These are rare Pyoderma cause. I repeat, what are the Pyoderma disease? First one is psychosis barbae, abscess, pyogenic paronychia, impetigo, boil or furuncle, carbuncle, cellulitis, erysipelas, Pyoderma gangrenosum, botryomycosis, ecthyma, etc. Now, mostly Pyoderma gangrenosum, it is defined as painful, non-infective, necrotizing ulceration of the skin. I repeat, Pyoderma gangrenosum is painful, non-infective, necrotizing ulceration of the skin with clean-cut bluish red overhanging edges, usually of the shin of the tibia, rarely on the trunk and face. So, what are the pathology? It is pathologically, it is one type of vasculitis, and it starts as a blister or pustule on the skin which breaks centrally and expands rapidly to form a ulcer. Sometimes satellite papules are seen at the periphery of the main lesion. It is indurated or purplish or pustular edges. That means it have indurated or purplish pustular edges, and when the ulcer is healed, it leaves atrophic thin scar. So, when the Pyoderma gangrenosum lesion heals, it produces thin atrophic scar. Frequently it is asked, what is pathargy? Pathargy means when a sharp needle is introduced on the skin, it produces similar type of pustular lesion It is called pathargy. What is pathargy? Pathargy means when a sterile, sharp pointed or a needle is introduced on the skin, it produces a pustular lesion. It is called pathargy. In case of Pyoderma gangulosum, pathargy test is positive. It mostly Pyoderma gangulosum appear at the age of middle age or a young adult, 25 to 54 years old, mostly on the leg. Usually the lesions are solitary, but may be multiple. What are the associated disease of Pyoderma gangulosum? Frequently it is asked on Viva or written. What are the causes of Pyoderma gangulosum? First one is inflammatory bowel disease, that means ulcerative colitis. Second one is connective tissue disorder such as rheumatoid arthritis, polycythemia rubra vera also. Third one is blood disease such as chronic granulocytic leukemia, multiple myeloma, myelofibrosis, and polycythemia rubra vera. Previously I have asked. And viral infection involving the liver, that means chronic active hepatitis. HIV infection and idiopathic more than 20% case. So I repeat again, what are the diseases associated with Pyoderma gangulosum? First one is inflammatory bowel disease, that means ulcerative colitis. Second one is connective tissue disorder, especially rheumatoid arthritis. Third one is blood disorder, that means CGL, chronic granulocytic leukemia, multiple myeloma, myelofibrosis, polycythemia rubra vera, and chronic active hepatitis. An infection also rare, that is HIV infection, human immunodeficiency virus, and more than 20% case it is idiopathic. How we will diagnose the Pyoderma gangulosum? First one is it is diagnosed by clinically, and it is diagnosis of exclusion. That means we will exclude the other pathology, other disease, and diagnose the Pyoderma gangulosum. And infective wound, from the infective wound we can collect swabs and it is sent for culture and sensitivity. Montos test frequently done to exclude tuberculosis, and last one is skin biopsy for histopathology for definitive diagnosis. So what are the treatment? First one is treatment of the underlying cause. Second one is treatment of the infective wound, that means regular dressing with antibiotics and topical and systemic antibiotics. It may need prolonged course. And local therapy for pain, and there is local steroid, that means topical steroid. Most important is systemic steroid or immunosuppressive agent such as Dept. Systemic steroid have a dramatic response on Pyoderma gangrenosum. If you prescribe the systemic steroid, within a week there is dramatic response. Mostly there is dramatic response, and clinicians often retrospectively diagnose the case is Pyoderma gangrenosum when the steroid dramatic response shows. Prednisolone 40 to 60 mg per day may prescribe in case of Pyoderma gangrenosum. If the steroid prednisolone is ineffective or less response, then pulse methyl prednisolone intravenously may try. And the relapse case, often we prescribe Dept 50 to 100 mg per daily up to several months. This is all about Pyoderma gangrenosum. Thanks to all.